segment, so if you have any questions during the presentation, feel free to type them into the chat box at the bottom left corner of your screen, and we'll try to address those during that segment. So I'd like to introduce today's presenter. It's Ron King, the CEO and founder of Vanguard Communications, a healthcare marketing and PR firm that has helped doctors promote their practice and manage their reputation since 1994. He's also the author of the book, The Totally Wired Doctor, Social Media, the Internet, and Marketing Technology for Medical Practices. During today's Pathways to Prosperity webinar, Ron's going to be presenting on how to improve online reviews for doctors and medical practices, focusing on why online reputation is important to business success in healthcare, as well as what preventative measures a practice can take to guard against bad reviews. So without further ado, Ron, if you want to take it away.
Thank you, Stephanie. So we hear a lot of talk these days about online reputation. What does it mean? And especially what I hear from a lot of medical practices and physicians is, how do I fix my reviews? Well, that's a great question. So I want to talk about it less from going back and fixing something and more from the standpoint of preventing something. So that's why I want to talk about vaccination instead of exasperation. When you get a bad online review, it's exasperating. It's easy to avoid them, however, by vaccinating against them. So first of all, let's talk about why we should care about online reputation management, and after that we're going to get into your choices for how to deal with bad reviews online. And then I want to talk about the half full glass. This is actually not as hard as a lot of people think, and there's a lot of reason to be optimistic. Fourthly, we're going to talk about some of those internal vaccinations you can do within your own medical group or practice to guard against reputation attacks. And then lastly, the real meat of it, I think, is 5 steps for building reputation. So without further ado, let's define online reputation management. Basically, it's defined as influencing perceptions created on third-party websites. These are the big 4 these days that we spend most of our time dealing with, and there's some others that we work with to some degree, but the vast majority of patient reviews are on these 4 websites, and these are the ones that we really work with on a regular basis. Now, who pays attention to them? Good question. The accounting firm Waterhouse Coopers has done a study, about 1,000 different Americans, and what they poll actually of 1,000 Americans, and what they found was that about 48% of those people read healthcare reviews, and that equates to about 150 million Americans. About a fourth of them, 24%, have written reviews online, and more than 2/3, 68%, have read the reviews online in making healthcare or other purchasing decisions, and that equates to about 102 million people. So a lot of people are paying attention to these. It's pretty important. Now, the Pew Research Center is a fountainhead of information about the Internet usage in regards to healthcare, and they find that about 3 in 4 people go online for healthcare at least once a year, healthcare information. About 3 in 4 also start a search engine, and about 13 of those percent, actually only 13%, I think is the operative word here, about 1 in 8 really started a medical specialty site like WebMD. They actually tend to go more to search engines. So search engines are very important. And according to the Pew Research Center, the numbers are a little bit different. They say a little less than 1/3 have consulted online reviews. Only 7% have posted them. 26% have read or watched somebody else's health online, sort of vicariously. So you can take this as the lower number and the Waterhouse Coopers as the higher number. In both cases, though, it's a lot of people. These are important. Well, most importantly, perhaps, beyond the people who are watching online reviews, is search engines. If you Google a practice name or a doctor's name, here's what you'll find in many cases. In the results page, and the search results page on Google or another search engine, you'll see that the practice website will typically be in first place in what we call the organic listings. These are the non-advertised places. And then right down the page there is a bunch of websites for rating your doctor. And here you have a real practice in California. And on the first page, 3 of the top 10 reviews are websites for rating your doctor. And you can see right away they have the number of average star ratings that practice has. So that makes an immediate impression on someone who's maybe looking for a new doctor. They can see at a glance how well this practice is generally regarded out there on the internet. So this is really important because this is a first impression that cannot be reversed. Search engine is very important. What's not so important is something I see that's a little disturbing out there. There are a lot of companies, many of them, dozens if not hundreds, that are selling what I think is a little bit of a magic elixir. They want to make sure you have monitoring software, which can be useful in some circumstances, especially for larger organizations, perhaps larger hospitals, larger national networks, or perhaps statewide networks. But for the most part, smaller hospitals and medical practices, certainly independent ones, don't really need this kind of software, and I'll get into that a little bit later in this presentation. So beware of the thought or the idea, the easy notion, that all you need to do is buy some fancy software and it'll help you fix your online reviews, good or bad. So a little bit of a side thought there. Instead, we want to talk about prevention. How do we stop so many reviews from being negative or critical, and how do we conversely improve the positive reviews? Well, there are three prevention strategies that we are very confident in here at Vanguard Communications. One is that you will always have unhappy customers. It's a fact of business. For those people, you want to deal with their complaints privately. You want to try to manage them before they go online and it becomes public. The second strategy, of course, is to respond quickly when there is a public complaint. And then the third one is pretty obvious. You want to encourage online praise. If you're good at what you do, and most businesses are, certainly most providers, healthcare, and others, have happy customers. We want to encourage them to go online and tell others about it. So those are our three strategies. Pretty simple, right? Now, this is what some physicians are doing instead. A little bit discouraging. They're suing some of their patients who said nasty things about them on the internet. I understand the feelings in many cases. In some cases, they're not even real patients who are doing these reviews. And in some cases, it's many, many extenuating circumstances that the physician or provider group cannot get into on the internet. It's unfair. This is not a fair system. Let's say that at the outset. Online reviews are not scientific. They're not just, but they are real. So we have to deal with them somehow. This is one way to deal with them, is to sue the people who say bad things about you. Well, how do they do when they sue the patients, when doctors sue patients? As you can see, it generates a lot of press, so I don't know that that's necessarily what they want. We have an expert in this field in California, Goldman, who is with the Santa Clara University School of Law, who's done extensive study in this area. Very interesting findings. He's gone through and researched cases of doctors suing patients, and here's three samples. And if you kind of run through his summary here and on the next slide, you'll see the plaintiffs, the doctors who were reviewed poorly, don't do very well when they sue. Their cases are routinely dismissed, or in some cases they're settled out of court. But there's very few instances of doctors or anyone prevailing in this kind of lawsuit, in so-called defamation lawsuits. It's a very difficult area of the law. And particularly for online reviews, the courts tend to favor free speech quite a bit. So suing doesn't feel like a great way to respond to these reviews. Now, for some insights into this, we did a study in 4 cities of 2 specialties, family medicine and, internal medicine and OBGYNs. We found physicians with 1- and 2-star reviews on these 3 websites in these 4 cities, and found 3,617 of them had 1- and 2-star reviews. So we went through and evaluated all those one by one, by hand. Here's what our rather surprising findings told us. Only 1 in 8 of all the physicians in those 2 specialists had 2 stars or less. So it's a very small minority of people, of physicians who are low ranked. Of those with 2 stars or less, 43% of them were reviews about doctor indifference in bedside manner, nearly half. 36% of those 1- and 2-star reviews complained about customer service, and 19%, or about 1 in 5, said they would not go back to the same doctor. Pretty interesting. 1 in 5 people were so upset they would never return again. So if you do the math here, what you find is about 1 in 5 people are concerned about the doctor's or the provider's real clinical skills. What really upsets people is bedside manner and customer service. And I got to tell you, if you want to entertain yourself on a cold winter night sometime, go online and read some of these, because there's some really entertaining comments here online. And here's a sample of some of them. It made for a very interesting and fun research project for our staff. So you can see bedside manner is everything. Just even a physician's appearance or a PA or a nurse practitioner's appearance can say a lot about the kind of care that patients feel they're getting. Customer service was a very, very common problem in our research, and it is elsewhere throughout the online reputation world. Many people complain about the staff's poor customer service, and of course about the physician running behind schedule. So these are things that really matter. I think bedside manner and customer service. Quality of care in our survey was only 20%, about 20%, 1 in 5 of the cases. That means 4 out of 5 times people are upset about not whether they're getting taken care of in a good way clinically. They're getting complaints about they're making complaints about whether they're being handled in a customer service fashion that would make them want to come back. So, bottom line here, the patient has a lot of choice here, has the ability to express his or her opinions on the internet. It's a democracy after all. The patient has a voice and the patient has a choice. So I say, like it or not, there's a lot of power to the patients. So, what this is all about is not about computers, not about software, it's not about how the internet works or social media or any of those things. It's about customer service. Let's get into, though, what is the starting point for this, which I think is pretty good news to hear. Let's go through a few facts here. Here's some other studies. The Journal of General Internal Medicine surveyed 300 Boston physicians and found 190 doctor reviews and 33 websites. Look at this, 88%, nearly 9 in 10 generated positive reviews. Only 6 were negative and 6% were neutral. That's a pretty small number of complaining people, unhappy customers. This is their conclusion. Physician rating websites offer patients a novel way to provide feedback, and a majority of reviews appear to be positive. So, what is all the fuss anyway? DocSpot, a website, did a survey of nearly 250,000 reviews, same kind of findings. About 2/3 of the reviews gave the highest rating possible to their healthcare providers, and 3 or 4 of the reviews gave the doctors positive rankings. Interestingly, chiropractors got the highest rankings and endocrinologists rated the worst. A side note there. But the takeaway here is that people are mainly happy with their healthcare providers. I would say probably much more so than they are with other services out there on the marketplace. And this is what we found in our review. When we analyzed the words of the reviews in those 3,617 reviews, we found that the words most often mentioned in order in those reviews were staff, office, and time. Care was number 8. Once again confirming, care is not the issue, it's customer service. Now, some practices are very thin-skinned about this, and there's a movement to actually prevent patients from reviewing their physicians online. And this is what some doctors and other providers are actually asking their patients to agree to, that they will not review their care in any way once they've received treatment. And I'm not too sure I know of anybody who would be willing to sign that very happily. So I don't know that that's a great way to do it. There is a website called Doctored Reviews that provides an alternative. This is also a joint project between Santa Clara University and several other institutions, and I think it's more the way to go. Their position is, why should you have any less information about your doctor than anything else you can buy out there on the marketplace? And furthermore, they also say, what doctor doesn't want your feedback? Do you want to see that kind of doctor? And thirdly, would you trust a physician or provider of any kind who predicates your care on your silence? I don't think I would, and I doubt very many people would at all either. So I think the point here is that we can really harness the power of online reviews. Rather than asking patients to sign a gag order, the founder of the healthcare blog on DocSpot posits, doctors should be asking their patients to fill out online reviews. I'm completely in agreement. I think you get a lot from online reviews to benefit your practice and patients. So let's talk a little bit about two ways to make the most out of those reviews, internally and externally. First, internally. There's some no-brainer things to do to really boost your reviews right off the bat. One is to be a culture where your entire organization is watchful, responsive, and preventive. Now, traits of a watchful culture. This means that all staff are trained to give patients full attention, including looking them in the eye, participating in active listening skills, being very good about what they're hearing from patients, being attuned and on the watch out for signs of dissatisfaction and satisfaction, of course, and knowing when to escalate a problem to upper management. Sometimes we just have people who can't be happy, customers who can't be happy, and we have to deal with them somehow. In a responsive culture, the staff is provided written guidelines for what to do and say in almost any conceivable situation, particularly one that might escalate into a problem. They are given deadlines for returning patient calls, for responding, for answering concerns, and so on, whether it's 24 hours, 48 hours, 5 business days, what have you. And they are trained also to have basic abilities to de-escalate tensions. Don't take things personally, but really work to calm the dissatisfied customer. And lastly, knowing when to kick things upstairs when they're a problem. In a preventive culture, everyone greets the staff, or greets callers, visitors, emailers warmly. They ask habitually, what else can I do for you today? They keep their chit-chat out of the earshot of patients. They avoid making excuses for when things go wrong, especially blaming it on a patient. That's a very good preventative culture. Other traits would include a live human answering the phone. I know this is sometimes practically not possible, but something as an alternative to just voicemail during business hours makes a very strong impression on patients. Dress is very important, dressing professionally, apologizing to patients when there are delays. Doctors get behind, everybody knows it. All most people want to hear is a simple, I'm sorry. Following up on your promises, on your communications, and so on. And lastly, embracing the idea that healthcare is a service profession. It goes all the way from the bottom to the top of the organization. All those are traits of preventive culture. Now, that's the internal point of view. Let's look at external here for a moment. There are really only 5 steps needed for a great online reputation management. And I'm going to go through these a little more slowly here so we have a good handle on them. First thing you should know is that more than likely you already have some sort of online identity out there, whether you created it or someone else did. And these days, more and more customers and patients can create an online identity for you. So the first thing you want to do is go find them. And that's pretty easy. You can Google your practice's name, your physician's name, what have you, and see what comes up. Go to those places, those links, in your search engine results, and see if there is a way for you to claim that identity. It's called claiming. And here's a great example. Google+, big growing social media platform that Google runs. And in this case, there is a location page in Google+ that you can set up yourself. This will establish the location of all your clinics, and you can type in the address, the phone number, and so on, and make this so much more visible on the internet than perhaps you are right now when people do Google your practice name or physician name. And furthermore, you actually enable patients to go to that page and fill out reviews. So in addition to the location page on Google+, there's also a profile page. And this is where individual physicians can register their own identity. Here's Dr. Ruben Alvaro of the University of Colorado. And you can see here we've set up his page as our client with quite a bit of information about him. And it also allows people, his patients, to go on and rate him and rank him and review him as a physician. So that is a great first step. You can do it on Google+, Yelp, Vitals, RateMDs.com, and so on. That gives you great freedom to handle online reviews in a whole new way, claiming that identity. Now, some websites will ask you for identifying information, and they do want to prevent your identity from being hijacked. So in many cases, you have to provide a physician's medical license number or his date of birth or some other inside details to confirm that that's actually him or one of his representatives or her or one of her representatives claiming his or her identity on these Rate Your Doctor websites. So claim and consolidate those accounts. Yelp is a particular problem sometimes because anybody can set up an identity for a business on Yelp without any participation from the business. All you have to have is an address for the business that you are wanting to review on Yelp, and we've had as many as 13, 14, 15 different identities on Yelp for one medical practice where patients set up individual accounts on behalf of that practice. Well, not on behalf, but to rate that practice. So claiming and consolidating, very important. Once you have the online account claimed, then this gives you great freedom and flexibility. In most of these websites, you can go in and set email alerts for any time someone posts a review of your practice or a physician. And what this does, it sends an automatic email to any address you like. This eliminates the need for a lot of monitoring software. This is all you need in many cases. Is just set up that email. It comes into your email box. You don't have to look for it. When you get an alert, of course, you want to go and read the review. If it's not a good one, here's an example of a one-star review from early in 2013. You want to alert the affected parties. If there was a physician involved, if it's a complaint about a staff member, whatever, you want to let everyone involved know about the review, get their response, their story, their side of the story, because the next thing you want to do is to prepare a response to that. And in this case, Muir Orthopedic Specialists in Walnut Creek, California, had a wonderful response to that prior review. It was a complaint about a patient being referred to other specialists. And the Director of Operations at Muir Orthopedic Specialists did a phenomenal job responding quite logically to the complaint, saying that we try to act in our patient's best interest to send them to the specialist who can best handle their case. You note that there is no comment about this particular patient's case. There's not even an acknowledgement that the reviewer was a patient at all. Rather, there is a broad comment on policy. And this, of course, removes any real risk of privacy violation or HIPAA problems. So you not only want to set up the monitoring tools, but when you are alerted by the monitoring tool, you want to respond as soon as possible. Another tactic is to provide a way for people to sound off, good and bad. We at Vanguard provide our clients with a feedback survey. We actually call it a snapshot because it's only typically about 6 questions, and we promote it through our clients to patients by saying it takes 5 minutes or less to fill out. 6 questions, that's not so bad. A lot of people will participate. You want a high compliance on these surveys. That's why we call it a snapshot instead of a survey. So this is an example of one for one of our clients. It's done on their website, and we promote this to the patients in the practice in a way that I'll show in just a moment. And as someone fills out a survey, then this data comes into the practice, and a designated person at the practice can read all of these comments and all of the responses that patients have filled out on the survey. So when you get these survey responses, there are 3 categories the practice should put them in. One is if somebody's really unhappy. That is a signal to contact that patient as soon as possible, and the survey should provide you patient's name, phone number, contact information, and so on. for you to reach out as a practice or as a representative of the practice or physician and see if you can resolve the issue before the unhappy patient goes online and makes comments. Conversely, best reviews, you want to encourage those patients to review you on any of those websites we mentioned before, Vitals, Yelp, Google+, what have you. And there are various ways to do that, depending on how you want to organize your practice and your marketing and your customer service practices. We won't get into all those details here. I will say, though, that we use a special software here at Vanguard to help us do that. And then there's everything else. People sort of in the middle. And I have to tell you, this category is probably the smallest. People are usually very happy or very dissatisfied with their quality of health care. And those are the ones who are most likely to review. Everybody else in the so-so category doesn't seem quite so inclined to make reviews. So there we have triaging the feedback. Now, we want to encourage people to use that review so you get as many of the patients reviewing their experience as possible, 100% if that's even possible. And in our case, for our clients, we print very colorful postcards, which the practices hand out at the checkout station each time. And on the back of that postcard is an address for the patient to go to on the practice's website for the satisfaction snapshot or survey. Very easy. So let's recap those 5 steps to better online reputation. 1, reclaim or claim your online identity and own it. Monitor it, obviously, and respond to it. Develop a short online survey on your practice's website. Number 3, really get everybody to use it. Number 4, respond as fast as possible to survey complaints, to critical online reviews. And lastly, make customer service the global religion in your organization. Pretty easy, isn't it? It's a little bit about the internet. It's a lot about customer service. If you do that, here's the sort of thing that can happen for you in your practice. This is an actual case study of a practice over a 2-year period, a client of ours. When we started with their program, they had a total of 31 reviews, 5 physicians in the practice. 2 years later, there were 267 reviews using these tactics, these techniques. 267, so nearly a tenfold increase in actually less than 2 years in the number of reviews. On the right, you'll see in the green chart that they had an average of 3 stars among all the customer review, patient review websites that these physicians in their practice were listed on. Average of 3 stars. 2 years later, at an average of 4 stars. Nothing changed in the practice, with one exception. One physician retired, another one took his place. That's it. And they did work on customer service, of course. And they did reach out to their patients to promote their snapshot, to ask them to post good reviews when they were happy, and so on. But it didn't take that much effort to have this kind of a change in a very short time. So this could be you. I do want to touch on one topic that seems to be a big concern, and that is, well, what about HIPAA and patient privacy and all that stuff? Well, it's a real concern, and we can't ignore it. However, there's a very easy way to deal with this, and the facts make it easy. The most common complaints from patients, according to drreviews.com, remember I referred to that website a little bit earlier in the presentation, do not relate usually to doctor's care or treatment. Instead, they're about non-confidential aspects, such as parking and waiting times and staff attitudes and billing and how fast the phone is answered. It's easy to respond to those concerns without saying one thing about any patient's particular case or privacy. Very easy. So let's not let the monster of patient privacy stop us from being good providers of service, good caretakers, and also good customer service deliverers. So I do want to point out my book, which Stephanie mentioned at the top of the presentation, is available on Amazon.com. There's lots about online reputation in here, but also about the internet and how it can work for medical practices, social media, a lot of things that I think a lot of practices would do well to know, and Amazon.com has it for you and to your door in a matter of a few days. So, Want to thank you for listening in today. We do want to say a brief word from our sponsor, us, and that is we are unusual in that we guarantee every one of our clients growth in new patient volumes through our marketing programs. And it's a very easy way to do it, that we do it. We actually bring the healthcare providers into the online and offline conversations that healthcare consumers are already having, and that in itself is enough to grow medical practices. We do it in rather sophisticated and complex ways, but the bottom line is patient education and patient communication. Now, I'll turn it back to Stephanie, who I think has some questions here that some of you have sent in. So if you would, Stephanie, why don't you just give first names and the questions some of you have submitted.
Okay, so I'm going to start with the questions regarding how to respond to bad reviews, both kind of a how-to as well as what should be included in that response to the negative reviews, as well as a follow-up question of should you respond to the positive reviews?
Okay, so the first question was, what should you say to bad reviews, and should you also respond to positive reviews? Is that right?
Right.
Okay. Well, what you say about bad reviews is completely dependent, of course, on what the review says. In most cases, 4 out of 5 times, it'll be about customer service. The easiest response to give, I think, is what you describe, dear reviewer, is not what we aspire to at this practice. Now, that's not saying that the reviewer is correct or even that the reviewer is a patient of the practice, footnote for HIPAA concerns, but rather to say that if someone describes a bad experience, that you as a practice are concerned to hear that, and you are working and will work harder on ways to prevent those kinds of bad experiences. And of course, as I say, it's usually about things that are rather easy to fix, parking or the cordiality of the person at the reception desk and so on. So that's how you handle bad reviews, and I think it takes a little bit of time and consideration given to each bad review to really develop a good response. Good reviews, I think, should probably be left alone. No response is needed, and it's a little awkward, actually, to say anything in response. It seems a little less than humbling to say, thank you, yes, we are great. So I think leaving the good reviews as is a good policy. Every now and then, if somebody says something really unusual or noteworthy, not a bad idea to thank them for it and show some humility and gratitude for their comments. But otherwise, if you say thanks for every good review, I think it tends to become a little bit of a disincentive for patients to continue reviewing.
There was also a question of, are there any other HIPAA concerns to consider when responding to reviews?
Well, the main one, obviously, is to not disclose any information that may be associated with the reviewer, any personal information, as the HIPAA office calls it, protected health information, PHI. You just want to be very careful, not even to suggest that you're acknowledging this person is real and is a patient. And sometimes they're not real. We have seen quite a few cases over the years where in fiercely competitive medical markets, we call them markets, cities, locations, where specialists particularly are duking it out for patients, there have been reviews that were questionable in whether they were really posted by actual patients or they were posted by competitors of our clients' practices. So I think that the main point here is to avoid anything that suggests that you are disclosing any kind of personal information about that person and to speak broadly about policies. Now, one good way to do that is if somebody really has a comment about his or her treatment or something that would venture into the territory of personal information, then the easy solution is to simply post a comment that says, we're very concerned to hear about your experience. We invite you to call us at our practice. Here's the number, so we can determine whether you are actually a patient and see if we can resolve your problem, something to that extent. And if you go by those general guidelines, I think you'll be pretty safe.
In those type of responses, can you come up with kind of a standard response that you just post each time, or is it really important to personalize the message each time you post a response?
I think it's incumbent to have some personalization. However, it doesn't have to be a work of poetry in every case. If you have a sort of scenario of 3 or 4 or 5 typical responses drafted in advance, and you can work off that and alter those in each case. One reason to alter them a little bit is that some websites are closely monitored by humans, and they may not post your response if it's a boilerplate, if it's a template that's already been posted once before. And the most notable one for this, of course, is Yelp.com. So some customization is good. You want to make it look like something more than an automated robot on the internet generating these responses.
And one person's asking, it seems that the majority of reputation problems that you see online refer mainly back to bedside manner, staff interaction, and the like. So wouldn't it just be better to address the issues within the practice as opposed to actually going online to reply to reviews and manage it that way?
Well, I think it's best to deal with them in both arenas. Definitely dealing with them within the practice is going to ultimately get you better customer service and better reviews. However, remember that when someone says something on the internet, it's out there on the internet, and it's typically there for theoretically infinity. So leaving it there unresponded to says to everyone else who sees those comments that you're indifferent or not paying attention. And I don't think that's the fastest way or a good way at all to building good online reputation.
You mentioned that, these reviews are kind of out there for everyone to see, and you also mentioned that Yelp can be troublesome for some of these practices and doctors. So one user is asking, why can't we just delete our Yelp so that it doesn't show those negative reviews anymore?
Because a patient can then go back and recreate an identity on Yelp in its place. Yelp is the 800-pound gorilla. Yelp has been the center of controversy for several years now because of their practices, including this rather interesting system of recommending and non-recommending certain reviews. If you're a frequent Yelp user, you're more likely to have your reviews posted in the recommended section on the Yelp website. If you've not been on Yelp before, this is your first review, chances are your review is going to go onto a different page that's a little hard to find on Yelp for any particular business. And on that page, it will be flagged as a non-recommended review. And that's because Yelp has this philosophy, and it's pretty defensible, that more frequently you use Yelp, the more likely you are to be a real person and a real unbiased and seasoned reviewer. Now, that's in theory. I think in practice, it's unfair to punish people who are just getting started with Yelp by not showing their reviews, and most unfairly to many of our physician clients, a lot of the really good reviews are not in the recommended section, are not easily found by anybody visiting Yelp, and that's just not just. It's just not right. But that's the way it is out there. So it's a great idea to encourage reviews as much as you can, and to keep your Yelp account open. Try not to discourage people from using it, and certainly don't try to delete an account, because I think it speaks poorly of you in case somebody sees the account before it's deleted and then comes back later and find it's been taken down. In fact, I'm not sure you can take it down.
And that's actually a really great answer to one of the other questions of why does Yelp filter and why are some of my positive reviews not showing, is based on how that user is interacting on Yelp in general. Another Yelp question is, will paying for a Yelp advertising account show more of my positive reviews?
That is a great question that no one outside of Yelp seems to have a definitive answer to. Yelp has a pretty good case that it does not. There are a lot of people who claim that it does, and sometimes I think there is an inference from those businesses that do advertise on Yelp that if they pay Yelp, they will be treated better by the way that their positive reviews are handled in either the recommended or non-recommended category. I don't have the answer. We generally recommend our clients have a good reason before considering advertising on Yelp. Yelp is just one of many, many, many places to advertise, and I don't think it's a good idea, if that's your sole reason to advertise, to buy a Yelp ad in hopes that you're going to get better treatment.
Okay, we're going to focus on some other questions in terms of management. One question was, how many hours a week should be dedicated to online reputation management, and who in my office should be the designated person who manages that, such as the practice administrator or the office manager?
Great question. I see this responsibility punted quite often to someone fairly low on the totem pole in medical practices, and I don't know that that's a great delegation decision. Conversely, practice managers and administrators don't really have the kind of time that's required in larger practices especially to handle this. So with some acknowledgement of self-interest, I believe the best of all worlds is to hire an outside consultant or a firm like ours or many, many others to handle it. Just being careful, though, not to simply buy software, but to buy a service in which you can verify that a person is actually handling it. For smaller practices, 1 or 2 or 3 physicians, maybe an hour a week, if that, is required. Larger practices containing several dozen physicians, it might take as much as 2 or 3 or 4 hours a week, but it's really quite erratic. It ebbs and flows. Some weeks there are no reviews, some weeks you're flooded with reviews. So it's not something you can set up as a regular weekly routine of any kind. I do think, though, in most cases, a good rule of thumb would be to allocate at least 1 hour a week. That's only 52 hours a year, including vacations and holidays. And if you take those out, we're really only talking about a 40-hour work week to handle this. Well, that sounds like a lot of time, doesn't it? Well, I want to say back to you, isn't your reputation your most precious commodity? That's the best thing a doctor has to offer to the public. So an hour a week is probably a good rule of thumb minimum. Larger practices a little bit more, obviously. And again, it will come and go depending on how much reviews and when you get them.
Another user is asking, when you search for my practice on Google, information about my practice appears on the right side of the search results, such as the location and our hours. How do I change that or affect that information?
Well, that's a little bit of a complex answer. I believe that webinar participant is asking about rich snippets, something that we know as rich snippets, where information is pulled from a website and displayed in the Google search results. That is something that takes a little bit of expertise on the website management side, and if you have a good website management firm or consultant, he or she or they will know how to structure your website so Google can find that information easily and display it in the search results.
And early in the presentation, you were talking about claiming Yelp profiles and Google accounts. What do you mean by claiming?
Okay, good question. Just a moment, more explanation on that. When you go to any of these review websites, you will typically see a little message in red or gray or box out to the side that says, "Is this your business?" Very easy to see on Yelp is a good example. That's usually a link. When you click on it, it opens up a new window or goes to another window in your browser. And there you will find some questions and an opportunity for you to answer those questions online to essentially make the statement that this is your business and you're going to claim it now, meaning that you're going to answer the questions and establish your online identity on that website. That information is usually submitted immediately when you complete the questionnaire. Then it typically takes several days for someone at that website management company to come back to you and verify that you are that business. And they will often do it through making a phone call through the number you gave in answering those questions. Sometimes they will send a postcard as well. And of course, that is how they help prevent fraud, because you want the address that you list and the phone number you give in the questionnaire to beat the practice's true phone number. And if anyone tries to hijack that, which we've seen before, it will actually go to the hijacker's address rather than the true practice's address. I think we're running a little bit short of time here, so let's have one more question and then we'll wrap up.
Okay, probably the big weighted one is, do you think patients really do choose doctors based on online reviews?
Well, I know one patient who does, and it's me. Absolutely, I do know that. I faithfully go to the reviews when I need a new specialist. And it's not because I believe they're gold and every one is true and accurate, but it's more of an indicator. You know, we don't want to gamble even $100 out on a dinner at a restaurant we haven't eaten at without checking out some of the reviews. We don't want to stay in a hotel or buy something on Amazon.com to see what other customers are saying about it. This is the same, I think, in online management, reputation management, and Rate Your Doctor websites. I am absolutely certain that a significant number of healthcare consumers out there rely on these, and that they will continue to do so in greater and greater numbers with the coming years. Okay, I think we're about out of time. Thank you all for joining. This will be posted to our website, and for those who signed up and registered for this course, you will get a link to that page. Be sure to tell your friends about the next webinar, and stay tuned yourself for the next webinar in the Pathways to Prosperity seminars series, and we'll be sending out information on that very shortly as well. Thank you, everybody.
Okay, and thank you, Ron, for a great presentation.